Good afternoon, and welcome to the Public Safety and Government Operations Committee meeting. In attendance today, we have, of course, myself, Mark Conway, Chair of the committee representing the 4th District, Councilman Cohen representing the 1st District, and Councilwoman Ramos representing the 14th District.
Thank you, Mr. Chair.
Today, the committee will hear legislative oversight 24-0063 on lead pipes. And this is for the purpose of inviting representatives of the Baltimore City Department of Public Works and the Baltimore County Department of Public Works, the Baltimore City Health Department, and the Maryland Department of the Environment to discuss the ongoing lead connection survey and the Baltimore Service Line Partnership that aims to proactively locate and replace lead and galvanized drinking water connections in Baltimore City and Baltimore County. This bill was introduced on June 10th, 2024, and introduced by myself. As you know, the introduction notes, we are focused squarely in this meeting on the Baltimore Service Line Partnership. We will not have the county here today. I don't know that it's really necessary. But that partnership is really an effort between the city and the county to inventory service lines, to make sure that those service lines are not made of lead or galvanized pipe. Those service lines are the connections between our water mains and our homes. This is all part of the lead and copper rule revisions that were released by the US EPA in 2021, and it requires that all utilities complete a service line material inventory and develop a lead pipe replacement plan by October of 2024. That date is coming up very soon. And really the goal of this hearing is to make sure that we are on pace to do that, and really to better understand how far we've gotten, what we expect, what we can do to better that effort, and make sure that as much as possible we are removing any lead connections within our water system, for safety and everything going forward. So with that, we're going to hear from a couple of agencies today. Of course, the Department of Public Works, who is here. We're also fortunate to have the Maryland Department of the Environment here to tell us a little bit about what the state's role is in this effort. I don't think we'll have any other testimony or anything. If there are other folks that do need to speak up, we're more than happy to invite those insights. So first, we're going to start with MDE, who is, I believe, joining us virtually. Yes.
Hi, this is Sean Canny. I'm with the Maryland Department of the Environment. I'm going to try and share my screen here with some slides that I have. Can everyone hear me? Okay.
Yes, we can. Thank you, Sean.
Okay, great. Okay, let's see screen. Okay, let's see. Okay. So I'm going to go over the lead and copper rule revisions. The shortening there is the LCRR. So my name again is Sean Canny. I'm a regulatory and compliance engineer senior in the water supply program of the Maryland Department of the Environment. So just a little background here. The lead and copper rule was a federal requirement published by the US EPA in 1991, and it required all public water systems to test for lead and copper in drinking water. So come back to, flashing forward to 2021, EPA published the lead and copper rule revisions in January of 2021, which required all community water systems and non-transient, non-community water systems to submit an initial service line inventory to the primacy agency, which is MDE, by October 16th of 2024. So water systems had to develop an inventory to identify the materials of service lines connected to the public water system distribution system and characterize the service line materials as lead, galvanized requiring replacement, GRR, non-lead, or lead status unknown. So there are also certain requirements for the water systems to make this information publicly accessible and to notify all persons served by the water system at the service connection with a lead, GRR, or lead status unknown service line Currently, that requirement is within 30 days of the October 16th, 2024 deadline for the inventory. If a water system identifies service lines with lead GOR or lead status unknown, they have 30 days to notify the homeowner or owner of the building that this was found. So once the materials of the service lines are identified, the water systems have to come up with a service line replacement plan by October 16th, 2027, or 3 years after the service line inventory spreadsheet deadline for submittal. Also, important thing to note here is water systems serving greater than 50,000 people have to make the inventory publicly accessible online. Okay, so how does a water system go about discovering these service line materials? So there's something called the visual inspection of the exposed service line pipe with or without excavation. So here you would verify what the service line material is going off of the material and diameter of the pipe. And this was accomplished through CCTV, so putting small cameras down these pipes to identify the service line materials. There's also certain excavation techniques, so actually digging up these service lines, mechanical excavation, for example, potholing, digging or excavating may be used for visual inspection of the service line. Potholing is a process using high pressurized air and vacuum. And then there's also something called vacuum or hydro excavation, which uses a water jet or compressed air to loosen the soil. Let's see, next slide. And then there's also material tests, and these are some things that homeowners and business owners of the buildings could actually do themselves to help lighten the load of identifying these service line materials. Pipe surface tests. This type of testing is performed on the surface of the service line pipe. It is easy for residents if the service line is acceptable. However, these methods will only indicate the presence of lead on the surface of the pipe and will not be able to identify the presence of lead on the interior of the pipe. For example, if you have a lead-lined galvanized iron pipe. So the types of pipe surface tests include scratch tests. So these are performed by scratching the pipe surface using a coin or key. And if the exposed outside pipe surface is a shiny silver and it flakes off, then the pipe surface is determined to be lead. There's also the magnet test. This can be used on the pipe surface to determine whether the pipe surface is lead, since a magnet will not stick to lead. There's also lead surface swab tests that can be performed using a swab kit approved for lead paint, and this will actually change color after it comes in contact with a lead surface. If the pipe is painted, however, the surface swab test may not be accurate. And then there's also something called electrical conductivity, eddy current, or electrical resistance test on the exterior of the pipe. This type of testing is performed on the surface of the surface line pipe, and the electrical conductivity is used to measure the conductivity of materials. So different metals have varied properties and therefore act differently when electric current is passed through them. So electrical resistance tests are used to measure the resistance of materials. It is a measure of its opposition to the flow of electric conductivity of materials. So service line replacement. So if a service line is determined to have lead GR, lead status unknown, it's required, the full service line is required to be replaced, not just partially. Again, once the materials are identified, the water system has to come up with a service line replacement plan by October 16th, 2027 to replace all the lead, GRR, or lead status unknown service lines. Systems have to replace service lines at a minimum average rate of 10%, calculated on a rolling 3-year period. And again, water systems serving greater than 50,000 people have to make the inventory available online, publicly accessible. And the service line inventory must be updated annually. So MDE is going to be collecting these service line inventories from every public water system in the state of Maryland, and these will be then sent along to the EPA because they have certain criteria that they need for their record keeping purposes. And that's it for me. I'm going to stop sharing my screen.
Thank you, Sean. I appreciate the presentation. We're going to get to questions after DPW's had an opportunity to present. So I will then hand off to DPW.
Thank you, council members, for letting us present our lead program to you and the status of it. Before we get started, just maybe some quick introductions. Marcia?
Marcia Collins, Chief of Legislative Affairs for DPW.
Hello, my name is Julie DiGirolamo. I am the Director of the Childhood Poison Prevention Program with the Baltimore City Health Department.
Julia Roche, Legislative Affairs Director with the Baltimore City Health Department.
Right. Yes, sorry, I'm Paul Sand. I'm the Acting Bureau Head for the Bureau of Water and Wastewater. Thank you again for letting us present our program to you. Before we get into it, just as you can see on the screen, every slide that you're going to see, just there's the QR code for the self-survey for the lead program. Very important to us to get as much participation as we can. Again, we'll go through some of the details of that in the next few slides. But for anyone who's watching, if you can just scan that code and take the survey, it takes only a few minutes. All you need is a magnet and a penny.
And Paul, just would you also mind saying it just for the record if folks don't have the scan ability? I know some people have trouble. The website for the survey. Where can they find it?
Well, it's on we have links on the DPW website. So if you just go to the DPW website, it'll take you to the Service Line Partnership website.
Awesome, thank you.
All right. I think you're going too fast. There we go. Okay. So the Baltimore Service Line Partnership, as you mentioned before, it's a partnership between Baltimore City, Baltimore County. We are one water system. And so we've joined forces to have the same messaging, try and follow the same approaches for the region. The partnership was formally formed in September of last year, but we have been coordinating with the county since the beginning of 2023. The Service Line Partnership Program was officially launched in December of 23 with the announcement from the mayor's office and from the county executive. And then as stated, we have a compliance deadline, October 16th of 2024, when we are supposed to submit our inventory and a replacement plan to the state. One thing to keep in mind is there's updated guidelines that come out on a regular basis, both from the state and from the federal government. The next update that we're expecting is the LCRI, that's the Lead and Copper Rule Implementation Guidelines. And that talks a little bit more about the deadlines and the requirements that go into replacing the lead pipe when any is found. So we're expecting more guidance as we go into the October deadline. So just want to talk a little bit about the outreach efforts that we've had to date. So we've had 2 city-county joint meetings that were done at the very beginning, thank you, of the program. One meeting in the city, one meeting in the county. We've had virtual town halls with the, in partnership with the Johns Hopkins University, their Heat Corps program. And then we've attended since the beginning of the year and continue to attend virtual and in-person community meetings. We've also had a pilot of 350 door hangers, just looking at what the response would be from that. And then we've included brochures and inserts into the city bills. That graph on the bottom, the blue line that you see is the number of pages that are viewed on our website. And then the yellow line is the number of surveys that are submitted on our website. So we track what public outreach efforts we have done and then look to see what kind of responses we're getting, whether it's the number of hits to the website or what we really want, the number of self-surveys submitted. So you can see we continue to try different methods to try and find approaches that will provide the most benefit, the most submitted self-surveys. So we continue to try different methods other than these here. We have another door hanger pilot that's starting up later this month. So I'm going to give an example, a little more detail of some of that data. This map shows the number of self-surveys that were submitted for the first week of February. The blue dots are the number that were, or the surveys that were submitted. And you can see we had a large concentration at Patterson Park. This is the Butcher Sale Association meeting was on that, in that same week. We had some discussions with the council member in that particular district. We looked at the website. What we're seeing is that for that particular area, the homeowners association is quite organized. They have links on their website to the self-survey link. They have information that comes directly from our website. They seem to be quite active in their community to get the word out. And what we've seen is that it's been positive effects to the number of self-surveys. So from the data that I showed you in the previous slide and this, what we think we really need is your help, the council, the mayor's office help in continuing to reach out to the communities. That seems to be the biggest driver for us to get the results that we're looking for. And if you recall on the previous slide, we had this big uptick at the beginning of the program when we had the original announcements by both the county executive and the city mayors. So what, in some conversations we've had, we really think that a day for the lead program and getting the word out through the council members to everyone about the importance of the program, of the self-survey, and try and get the word out so that we get a significant increase in the number of self-surveys. There we go. So this is, again, some more data showing the number of self-surveys that have been submitted by council district. You'll see the participation rates for each district on the far right of that table. So we've had roughly 4,400 surveys that have been submitted to date. That's about 2.4% of participation rate for the entire city. Out of that 4,400 surveys, 271 are renters, 4,000 are owners, 45 are property managers. So obviously the vast majority are property owners, residential property owners. We still have roughly 178,000 properties with unknown pipe material. So again, some more data, just showing this is for the month of mid-May through mid-June. That graph on the bottom is showing you the number of website hits, the number of hits we get to our website. For that 30-day period, you can see we've had some peaks and then a drop off. So in that time period, roughly 1,800 hits to the, 1,800 sessions, 2,400 pages have been viewed. So 1,800 hits to the website, and for each session, for each hit to the website, 2,400 pages have been looked at. So roughly 2 pages for every person who hits the website. And out of that, 1,800 hits to the website, 923 surveys submitted. So again, each website, it seems that when they get to the website, they're hitting 2 pages. The assumption is the home page and then maybe the self-survey page. Less than half of the website hits actually result in a submitted survey. So people are going to the website, presumably they're reading the information, but they're not submitting the self-survey. And that's what we're keying in on. So we've actually added some features to our website. There's another button that people can go to and tell us why they may not be able to do that self-survey. Maybe they don't have a magnet, maybe they need something to scratch the pipe, maybe they don't know where the pipe is. So we've recently added that in the last 2 weeks, and we're gonna start looking at that data to see maybe there's something that we can do to help people not just go to the website, but actually take the self-survey. And you can see since the beginning of April, we've averaged about 5 surveys a day that have been submitted. Again, we had that big jump at the beginning of the program. So where do we go from here? So we still need to look at how can we reach out to the community and get the participation rate up. I will note that even though the participation rate seems is low, that 4,400 self-surveys have resulted in us having saved approximately $3 million. It's $600 to $700 per self-survey, per inspection when we go to the field inspection. So if you multiply 700 times 4,400, that's how much we've saved so far. So even though it's a low participation, we really need, the more that we get, the more we're going to save. And so even a little bit goes a long way for us. So where do we go from here? We have started since the beginning of the year at what's called predictive modeling. It's a statistical analysis that takes that groups all the properties with unknown pipe material it groups them into classifications based off of geography, social economic criteria, what the neighboring properties, what material they have. And so we have these various groups and then taking sample inspections from sample sets of each group. So instead of having to do an inspection of all 178,000, maybe we only have to do a couple thousand, and with 90% confidence, we can say these other properties, based off of the model, are or are not lead. So that's our plan. Instead of having to do inspections of every property, let's focus on these thousands of properties that will help our model to learn. It's based off of some algorithms, some artificial intelligence that learns as it gets more data. So the more data we're able to provide, the more accurate the model is. So we have these couple thousand that we've identified, and now the goal is we focus on outreach to those properties. So we're looking at social media advertisements. We started that at the beginning of the year, directed at those property owners. Door knocking is supposed to start later this year at those properties. Postcards, customized postcards have been sent to those properties. And we recently awarded the electroscan inspection. It's a type of inspection method where we can, you'll see the picture on the right-hand side. We remove the water meter, we insert a probe into the service line, and then that probe is pushed through the service line all the way to the face of the house. So we're able to identify the pipe material without having to do any excavation. The water is out of service, or the house is out of service for 1 to 2 hours, depending. And then we flush the line from a hose bib afterwards. So that's where that $600 to $700 per inspection cost comes from. So we're looking forward to starting that work up over the next maybe month to 6 weeks. That is a technology, as the MDE had mentioned, that is a technology that's accepted. The predictive modeling is also an accepted method. So we're really embracing technology as best as we can, not only to build our inventory, but reduce costs and get it done as soon as we can. So in addition to that predictive modeling and focusing on those thousands of properties, we also have a public outreach to the rest of the city. We have public outreach going out to the summer schools. We have flyers that will be handed out to the students. We also have the same thing at the recreational pools. We have a second door hanger pilot that we're going to be starting up. That one has a different message to the door hanger. We're looking to see if that message would result in any better participation rates. So that's where we're hoping that a different message will provide some benefit to us. We're extending the door knocking program, so not just on those 3,000. We have a smaller program, but that'll go citywide. And that will incorporate not just the lead pipe program, but lead paint and some other city services. And then we all obviously have to, based off of that information, develop the replacement program. We're not at a point now where we can quantify with any confidence how much lead, if any, we have in our system, and then what does that cost. And I think, as I mentioned before, we really need to make our decisions or balance our decisions with the financing. How much can we actually afford in any particular time? Maybe we need to spread out a little bit further. We'll get the work done, but we need to take that into consideration. I'll turn it over to the City Health Department.
Hello again. My name is Julie DiGirolamo. I am the director at the Baltimore City Health Department with their Childhood Lead Poisoning Prevention Program. So just a little bit of background information on our program. The Baltimore City Health Code mandates that all Baltimore children are tested at the ages of 12 and 24 months of age. So my team goes out and does the actual testing to find out what their blood lead level is. There's no safe lead level, but we do base our guidance off of the CDC guidance, which is 3.5 micrograms per deciliter. So any cases where a child tests more, 3.5 or higher, we go in and we do medical case management. We also do home visits to provide education on how to reduce lead levels. And then we also, in some cases, go into the home to find out exactly where that lead is. So my team goes to take dust samples and do XRF readings to find exactly where in the home the lead is. We work on the enforcement of the city's lead laws, and then we also do a lot of education and outreach to help connect families to any additional services that they would need.
There we go. And that was the end of our presentation. Certainly happy to take any questions you may have.
Thank you, Paul. Really helpful to kind of get a sense of the strategy for the city on how we're tackling this. Of course, this is a really, really important issue and I think opportunity for us to address a significant problem. I had a couple of questions, and so we'll open up to questions. So first, I know the city received some money, some federal funds in order to do the inventory. How much is that, and what does that cover?
Yes, thank you for that question. So we actually have two loans that are still being processed. So they haven't been finalized yet. One loan, they're both from the state revolving fund. One loan is for $22 million. That's for developing the inventory, and then $23 million for the actual replacement work. So the paperwork is being processed to actually close on those loans.
And so this is a loan to the city, and that we'd have to pay it back?
It's a loan to the city, and I believe 49% is forgiven.
Got it. And so that's forgiven by the federal government?
Correct.
Got it. And then I know you mentioned we have 4,400 surveys that have been completed to date, roughly 177,000 outstanding. We got quite an uphill battle. You did note that there are a couple of ways that we can get to the finish line, even though it may not necessarily mean checking every single line, but we could have a pretty strong guess of how many lead lines we have across the city, and that would be through that sort of algorithmic approach. Do we expect to survey the whole city, or at least for that algorithm? Do we think we can meet that?
We will have survey whatever's needed for that model to get to whatever a certain percent confidence level. What that final number will be, we don't know right now. So we're starting with the first couple thousand. One thing to keep in mind is the the guidelines now, so we can submit the plan today. And it may have 177,000 unknowns. That's absolutely approvable by the state. It's not what we want to do.
Right.
My point being that we will hit our deadline. It's more of a question of how many unknowns we're going to have.
I see. I guess to tie to my first question, to my second question, with the money that we have, if we don't identify enough lead lines and galvanized pipes, could we lose some of that money for replacements? The 23 million for replacements, could we lose some of that? Or-
Yes. Once we close on the loan, we can, if there are lead lines or galvanized pipe that need to be replaced, we can certainly use it towards that.
Sure.
We're still trying to figure out exactly how much, if any, would actually be used on the private side. Again, until we quantify it, we're not at a point where we can say what that number is going to be.
Got it. And if we identified more lead lines than the rough estimate of what we initially received to do the inventory and replacements, if we identified more, could we conceivably receive additional funding?
Yes, there's additional funding available for the next few years. So I will say that here in the city, anecdotally, we've been told we're probably the furthest along as far as a water system owner in the state on the program of getting the self-surveys. Not too many other utilities or system owners are doing self-surveys using that new technology to try and reduce the actual amount of field work. We do meet with the state on a monthly basis, so we have a discussion about those logistics and the funding sources as well. Just making sure that when we're ready, that funding will be available.
Got it. And last question I'll hand off to my colleagues before coming back for a round. With the sort of algorithmic assessment, do we have a sense of how many service lines we'd have to check to have a reasonable degree of confidence for the city?
So we've been doing record research for a number of years. So we already have some data. As I said, we've identified a couple of thousand more that the model is saying if we provide that through the model and to the model, it'll produce another output. We don't know yet what that output would mean as far as the confidence level. All we know is this is the minimum amount of data that we need to provide. Okay. And then once we see the results, it may turn out we're done. We can say with 95% confidence that this property is or is not lead, but we don't know what that final number is going to be until we go through this iterative process.
Okay. All right, last question, then I'll hand off to Odette. Do we know how many lead lines or galvanized pipes we've identified thus far?
There's been maybe 2 handfuls of suspected lead lines. So these are identified through the self-survey. Yeah. While we're confident in the results of the self-survey, we want to do the field investigation to confirm it before we do anything else. So we will be doing that. So we're calling them suspected at this point, but it's a fraction.
Okay. I'll hand off to my colleague, Councilwoman Ramos.
Thank you, Mr. Chair. And I'm really glad we're having this because I think there were a lot of questions from residents. Happy for the 14th district. We're ahead right now. But and that might be a good idea for us to compete again so that we get this done. Anyway, so just to clarify what the pipe we are looking at right now. So all of our mains where the actual clean drinking water comes through, all lead safe. We know that for a fact. What they're trying to help us get to with MDE and the federal government is what's going on between the meter and the house, correct?
Correct.
Okay. So, and because we don't have records going back many years of how old the city is, to know what has been installed there, we have to do this exercise, correct?
Yes.
Okay. Just wanted to make sure we were clear on that. So I guess the question that I have is, can you detail for us and the public how does the public use the penny and the whatever else it is to test the lead in
Yes.
their pipes? And where is it? It's not like we're gonna try to dig, they can go to the faucet, right? What are we asking people to do, is what I'm asking.
So we're asking the people to, wherever the water main comes into their house, it may be in a crawl space, it may be in the basement, but wherever it comes into the house, the penny is there to scratch the surface so that you can expose the true color of the pipe. Sometimes it might be dirt or incrustation on the outside of the pipe. So you just want to scratch that off and take a look at what that color is. If it's a brass color, it's a copper pipe. It's suspended copper. So you do the scratch test, and then we look at if a magnet will stick to that pipe. So if it sticks, it's one type of material. If it doesn't stick, it's another type of material. And then just to tap on that pipe, whether it's with a pencil or a penny, just to hear what the sound is. If it's hollow, it could be a copper pipe or galvanized. If it's more a dull sound, like it's a thick metal, it might be lead. So all of that is available on the website, brochures. On the QR code, you'll be able to see all the information on the different colors, the different sounds, whether the magnet sticks or not, to tell you whether that's lead or not.
Okay. That's helpful, and I'm assuming there's a video somewhere.
Yes, there is.
Okay, to be able to let people know also what to look for. It sounds fairly simple, because when we talk about, oh, you got to test the lead pipes, it's like, what are we supposed to do?
Yes.
And so I want to just be clear that you just need a penny, you just need a magnet, and read through the questions to see. And that if you find that your pipes are lead, not to freak out, but what then do? They fill out the survey, and then is there another step so that there can be a sort of an emergent response if they do find their lead pipes?
So all the inspection data you fill out on your computer or your phone, whichever, and you send it to our website where we look at it. We do a review of all the data that's submitted to confirm whatever the results may be that the customer had found. And then depending on that material, if it's suspected to be lead, again, we'll be doing some field investigations. We don't want to dig up just because someone suspects it. We want to know for sure. That communication, we have not yet started. We're about to start that now.
Because I think I expressed this at some other point, and maybe it was budget hearings, that I can imagine that if someone finds a lead pipe and they especially have children in the home, that they would want to have an immediate response to try to figure out how to address this. So do we have that plan in place? Have people said, oh my gosh, I have children in the home and I have a lead pipe?
We haven't received any comments like that. I think it's very important for the public to understand that for DPW, we treat the water, and so it has some chemistry to it that avoids or minimizes the amount of metal that's corroded. So whether it's a galvanized pipe, a copper pipe, or a lead pipe, the water is treated in such a manner that the corrosion is minimal into the drinking water. And we've always had safe lead levels for decades. We've had a replacement program in place for generations now. And in fact, we just published our consumer confidence report. You can look at the most recent results there. It's pretty. The average lead level throughout the system is minimal.
Right, we've always had top-notch, if not the most highest quality water in the country. We've been up there pretty high. Mm-hmm. So the message then is we do want to work to figure out if you definitely have lead pipes, and if you do, we're going to figure the next part out. But that the water is treated with whatever it is treated with, that it doesn't absorb, if you will. I'm not using the technical terms, but I'm just trying to understand that doesn't absorb the lead if there is lead in there. Is that what you're saying?
Yes.
Okay. But I would just want to caution to DPW and also to the state that if, someone does say, oh my gosh, I've got these lead pipes and I've got children in the home, that we're able to communicate what they can do, because maybe they want to put a filter on just for their peace of mind or whatever. I just want to make sure that messaging is also, part of it.
Yeah, we certainly, if someone were to call and ask for a lead test, we can certainly do that. In fact, we're reaching out now to our customers for our annual reporting, trying to reach out and we're actually trying to find 50 residents who are willing to let us do lead sampling in their homes. And it's difficult. So certainly, if anyone has concerns, please reach out to DPW. We'll do whatever we can to allay those concerns. But the first message is the water is safe. It does not corrode any kind of metal pipe. Well, it's minimal. It could corrode any kind of pipe, whether it's lead or copper or galvanized pipe.
And I just want to mention that if people are concerned, obviously, as Paul says, we're going to go out and try to confirm whether this is indeed a lead issue, but they can always call 311 and request a water sample.
Okay.
Because that will require someone being at the home and allowing us to go inside and take a sample. And the folks who do those samples know how to do it. They have to clean off the faucet, all these procedures they need to go through.
Sure.
So that they can have some peace of mind.
Okay, that's very helpful, thank you. That's good messaging that we can also give out if somebody is worried about it. Okay, great. I have a couple other questions.
Let's come back.
Sure.
Councilman Cohen?
Thank you, Mr. Chair. Thank you to the DPW and the Health Department. Just a question for the Health Department. I know a lot of the thesis of this hearing is about lead in the pipes, but we know that historically in Baltimore, we've had a significant challenge with lead paint in homes. I know in the late 2000s, there was significant effort to reduce lead paint exposure for kids. I think Green and Healthy Homes and a number of folks in the health department and others very dramatically reduced the amount of lead paint exposure that children have. But we have very old houses in Baltimore, and many of those houses still have lead in the paint. So could you provide just a quick update on where we are in terms of remediating lead paint poisoning and getting lead paint out of homes in the city?
Absolutely, happy to provide an update. So we, like you had mentioned, we've drastically reduced the amount of children who are exposed to lead. And what my program does with the health department is that we proactively test children to find out if they have been exposed to lead at all. And if they have, we work with the owners of the home on how to reduce that lead. So what's that called? That's called a abatement process. So that is removing any lead that is exposed. And then we also, there's different remedies that can happen. So covering up the lead so that it becomes safe for the child to return back to the home. And if you're looking for more specific numbers, I'm happy to look back into that and get back to you.
Yeah, I'd be interested in just seeing some of the data on that. I know it was I remember reading just a very substantial drop in the amount of lead poisoning that we're seeing sort of following the 1990s. So yes, I would appreciate if you could provide an update on just the numbers and where we are. I know there's still neighborhoods in our city where we still see a high incident of lead paint poisoning relative to the rest of the state and country. So I'd love to know where we are on those efforts. Thank you. Thank you, Mr. Chair.
And for tracking purposes, Councilman, can you just repeat it one more time for me? The request.
Yeah, so data on the amount of homes that we have abated the lead paint, the amount of homes that remain with unhealthy, as you said, no amount of exposure to lead is acceptable, but the amount of homes that remain that are still have lead paint in them. Does that work?
Yep, got it.
Thanks, Delaware.
Thank you, Councilman. I want to focus a little bit on the outreach. So when we initially launched this initiative, I think in November, We had that initial bump and had probably our highest bump, except maybe after the mayor maybe we need the mayor again. But the highest bump was when we first announced the initiative. I don't recall if that's where we saw the highest survey count. No, the highest bump was after the mayor's announcement in December. Interestingly, the highest survey count was after the Spanish instructional
Yes.
video.
Yes, yes.
So it brings to me two questions. For our outreach efforts, what success are we seeing? What are we thinking about between now and October to make sure that we can get this message out to as many people as possible, leveraging media, social media, council members, community associations, door knocking, volunteers? I mean, this has to be a significant campaign, I would imagine, across the city to let people know that this is our opportunity to identify, if at all possible, whether or not there are lead service lines, so that we can hopefully replace them as quickly as possible. So can you talk to me a little bit about our outreach efforts, what has been working, what maybe hasn't been working, and what we're thinking about doing into the future to maybe get a little bit more engagement in compliance with the service?
Yes, thank you for that question. So again, as I mentioned, we've tried all different formats, and nothing that hasn't resulted in any significant increase in the participation. As we talked about previously, I think at this point, really, it's about engaging with the city leaders, the city council, and the mayor's office. That's when we saw, obviously, the biggest increase in our participation. And maybe it's a one-day, get the lead out, whatever we're going to call it, but a campaign where we can have all the council members advertise it to their communities. Maybe it's events going on that one day.
I bet you we can beat the mayor's bump. What do you guys think?
I challenge the council to that. It's really, I'm sorry? I think it's pretty obvious from what we're seeing. It's really about engaging with the city leaders. And that's where we've seen by far the biggest participation. And that's where I believe we need to pivot to. These other outreach events and outreach media are nice, but they're not really changing the course. We really need to focus on what has. And to this date, it's been that city leader involvement.
Yeah, you've got a small group in front of you right now, but I assure you, all of my colleagues would be more than happy to share the message, make sure we're talking about it when we go to community associations meetings. I had an opportunity to do that a little bit in my meeting last week in my district, and folks had a lot of questions. I think folks want to know, what they need to do, how to do it, and whatever materials you can share with us to help spread that message. I'm sure all of us would oblige. So the other question I had was regarding that Spanish instructional video. So two things pop out here. One, Spanish, two, video. Clearly, I think there was a huge impact on that for our Spanish speakers, and so it makes me think about our Spanish speakers especially, but making sure that we have multilingual media for folks that may have difficulty with English or the inability to speak or understand English. I think that's a big importance for us. I don't know what we have by way of the website for folks that may be even tuning into this hearing to navigate in the Spanish language. So just a thought there.
Yeah, just for your information, so all of that was one of the Spanish media that we put out. That was the first of what we saw as an opportunity, and we actually went ahead and all of the information that we put out on the website and paper, it's both English and Spanish. On the website, you can actually change it to multiple languages.
And the video.
The video is in Spanish too.
Yeah, my point is broader though, not just to Spanish, but I think video content could be really, really helpful you know, for folks that maybe are not going to read it. Some people, they get something as a door hanger, and they're just going to immediately throw it out. And so I'll be really interested to see how the door knocking campaign goes once we start that. How soon will that happen?
So our first pilot was ended a couple weeks ago.
Okay.
Very low participation, if any, from that. Again, we changed the message, and we're going to see with this next version if that changes anything.
Yeah.
It had Spanish on it as well, yes.
It has
English and
Spanish on it as well.
Yeah.
When did the door knocking happen?
I'm sorry, I was talking about the door hanging.
Door hanging, okay.
I'm sorry, the door knocking, I think we're scheduled to start up in 2 weeks. And that's in the couple thousand properties that we're focusing on. And then the campaign for the rest of the city, that probably start up in August sometime.
Yeah, you know, we've all run campaigns here, and I can tell you the door that is opened is way more valuable than the lid that is dropped.
Yeah.
But you know, I think there's an opportunity here as well. You know, if there's video content that we can share on said handouts, but you know, making it as easy as possible for people to understand the very simple 5 steps they need to walk through in order to collect the information and then report the information.
Yeah.
But then also having those, you know, in-person conversations, I think, go a long way. You also said something during the presentation that stood out to me and you know, seemed to be an opportunity, and that was around partnerships with community associations.
Yeah.
I know me, anytime I'm doing anything in my district, I immediately go to, you know, community association leaders, and they can help me get things out. Have we, with the exception of the one instance, I think in the first district, have we been tapping into those community associations and using that distribution list to coordinate and work with them on outreach?
We have, since the beginning of the year. Those meetings have been a combination of virtual and or in person. But regardless of the media type, still haven't seen the participation that we were hoping for. We don't know if maybe the council knows of more active associations in your particular districts that we can speak to, whether it's in person or virtual, or events. But we do have regular meetings just on work that we do at DPW with all the community associations. So we talk about lead at those meetings.
Yeah, we have a program in planning, I believe. Let me see if I can find the name of it again. The Care Lot program. Are you guys familiar with the Care Lot program?
You're talking about the cleaning program?
I think it's a cleaning program,
Yeah.
and it partners with community associations to clean up in communities.
Yes. Clean Core?
Is it Clean Core? Yeah. Anyway, leveraging those and relationships to get that outreach out there, because ultimately we're not going into people's homes. Don't really know why we don't have that ability, but maybe you can explain that. Maybe others have that questions as well. I think I asked that before and I've already forgotten the answer. But making sure that we're tapping into the people that have those relationships and can get people to open their doors and insist upon them doing this check might help us a lot, especially if we're gonna prioritize in ways to get certain areas. Maybe we don't need every single house on the block, but if we can get 1 or 2, that'll give us a strong sense of where the community lands. That would be really helpful.
Thank you for that suggestion. We'll certainly talk to our sister agency at the Bureau of Solid Waste, get those contacts if we don't already have them. Certainly try that.
Yeah.
Maybe to your previous question about going into people's homes, we've had discussions, multiple discussions with general counsel about that. We're not going into people's homes for 2 reasons. One being liability, and then 2 is for personal safety. So we really stop at the door.
Yeah, got it. Makes sense. All right, I'll hand off to my colleagues. I'm sure there are more questions.
Yes, thank you. This is a question for the health department. When a young person is tested for lead and has elevated levels, there's usually a mechanism for testing the home. right? Are you also following up and testing like this on the pipes?
So currently, and my team is going in and testing in the home. Our protocol is to take dust sampling, and then we use what's called an XRF machine. So that goes and can test exactly where on the walls where that lead is from the paint. We currently are not using it on pipes, just because in Baltimore that historically isn't the main source of where the lead exposure is. Our main goal is to lower that elevated blood lead level. So our goal is to go in, find exactly where that lead is, and then have the lead removed through abatement, and then we expect to see that the lead level would drop. If for some reason that lead level is not dropping, then we would go in and do more testing, but the pipes are not something that we would typically test.
Have you developed a protocol to at least alert DPW that there might be lead in the home so that they should probably test the pipes, or that this might be a targeted house to think about?
Hi.
Hi.
Camille Burke, Deputy Chief of Staff, but outgoing Director of the Child Lead Poisoning Prevention Program. As Julie said, we don't normally test the pipes. However, we search until we find whatever that particular source is. So water is one of the things that we will test, and more than likely, water will come from the pipes, and then we reach out and involve DPW. So I wanted to just clarify that.
So, but in this particular, and I appreciate that, I realize that, once there is the indication that there is a immediate try to figure out what's going on. So you do the house first, then you do, so then the water is next. But I guess I was just wondering if there was any sort of protocol between, especially now with this program, between the health department and DPW.
Normally, there hasn't been, because we literally either have a conversation with the landlord and or the who owns the house. And literally, once we work up the work plan and we figure out what the source is, that's kind of how we tailor our instructions. But because of the advent of this program, we literally have developed a better relationship with DPW to literally do what you just said.
So is there a formal protocol then where?
It's not formal, it's in development.
But you are working on it, is what I'm hearing. Okay. I think that's one of the ways that you can detect some of these other pieces. And obviously we know, based on what you said, that it may not be the water, but I'm just trying to cover all the bases here. So, okay. Thanks for that clarity. I really appreciate it. My next question is about the fact that we have all these vacant properties and nobody's going to be testing the pipes there. Some of them, the water is still on, which we had a whole conversation about during budget hearings, so I'm not going to and I'm still having those conversations. So we're not going to go there, but I'm just kind of wondering how this is, obviously the regulation and the demand is for every, household to be inspected. So that means there's 13,000, I would say more. There's actually way more than 13,000 vacant properties in the city where there's nobody in them, but they don't qualify for a VBN. So how are we handling that?
So thank you for that question. That's where the electroscan inspection comes in. So we could just remove that meter and do the inspection without having to.
Super easy.
Yeah.
So you've already, basically you've identified there's these properties that we know of that are vacant and abandoned that we can just go ahead and do that and take care of that piece. Yes. But there's, again, I contend that there are, I can tell you which ones they are in my district for the most part, people who have either passed on or have left with nobody taking care of the property. It doesn't qualify for a VBN because it's not falling apart. And so what are we going to do with those?
So again, it's whatever thousands of properties that we have identified to this point, if that's one of them, we'll just go ahead and do our inspection, regardless of whether it's vacant or not, who the property owner is or not. We'll just go ahead and do our inspection. So we'll address that.
So if they're not going to be as obvious, right? So is it based on some of the stuff we're working on with OPI, which I had suggested during budget hearings, is like, look at all of these properties as really high grass and nobody's taking care of it, right? That's automatically, nobody's in that house, period. So there's that, the 311 data on high grass could be one way to look at it.
Yes, yes.
The other way to look at it would be through the analysis that you talked about in terms of that targeting, right? That's what you're thinking about. Okay, because I think it would be good to continue to still look at all of those, even if they're not occupied, because then either the pipes are fine or they're not, and we can just, when you get to the replacement part, that can be taken care of.
I think that maybe we're ignoring the most obvious, which is if there's properties that, for whatever reason, are not showing up on our records as vacant, it's really communicating with you, with the neighborhoods, and identifying what properties those are. So that's where the engagement comes in with engaging not only with the council, but then the homeowners, the community associations.
Yeah, no, absolutely. I'm just giving you some other data points that might be helpful relative to at least taking care of those where I get the community process where you're not going to go in and, inspect every property, but you've asked the community to be a part of this process by inspecting their pipes, filling out the survey, and taking any next steps that are needed. And that's your sort of process of elimination, if you will, right? So then you can take care of the VBM properties, you can take care of the properties that have high grass and weeds, because I guarantee there's nobody in those properties. And then go, continue to sort of narrow down the list, I guess is what I'm suggesting. But I just also wanted to make sure that that those are part of your 170,000 homes that you still have to do.
And then, Councilwoman, I would offer that if you or any other council member has these similar properties in your district where you know that they don't qualify for a VBN, but they are vacant for various reasons, that you share that information with us so that we can ensure that it gets to DPW and those inspections can take place.
Yeah, because the other issue is I've got several of those properties where the residents mow the lawn because they don't want the house to look bad next to them. I mean, guaranteed. So yes, I think that's part of the conversation as well. So that's, but I just wanted to make sure that we had that, understand where that information is. And I would be interested, we're currently, my office and I are delivering our paper newsletter, and it's physically delivering it. So I'd want to see if there's any inserts or anything that you have, paper, flyer or something that you can get to us that I can put in. Well, since we're out there. And then just to reiterate, the deadline for you need to have 170,000 properties inspected by October, or?
We need to submit our inventory by mid-October, but that inventory could include 177,000 unknowns. It's really a matter of how many unknowns are we going to have by the middle of October.
Yeah, but you don't want that many unknowns.
No, we do not. No.
Right, but what I'm saying is you need to have either the survey completed or inspections done by October of 2024.
Correct.
Okay, that's a lot.
It is.
Yeah, okay. Yeah, so we'll have to get together and figure out what the best way is to move forward on getting that information. Thank you.
Paul, is there at times that we can, extended periods in which we can add to that inventory?
Yeah, so that's part of the LCRI guidelines. So we need to submit, I'll call it our initial inventory by mid-October. The new guidelines are providing an extension to 10 years more to identify or finalize your inventory and then replace the lead pipe, if any. So we have another 10 years to actually replace the pipe. We don't want to go that far.
No, that doesn't we wouldn't want to do that, because if we're going to ask the federal government to help us pay for replacement, we might as well just do it all at the same time and not try to do it 10 years out with all kinds of other challenges that are before us in an upcoming election. So you know what I mean?
Yes, I do. We're moving full force on getting as much as we can done by October, but this work is going to continue for a little while.
Well, I mean, it's good to know that we have a buffer, but I think that we certainly have, deadlines are helpful for us, is all I'm saying. Thanks.
I'm curious, we talked about vacant properties, we talked about instances like that where we may have to use that contract to check at the meter. Do we have a sense roughly right now on how many properties are vacant and would qualify for that? Or if maybe we're not going to do all of them, maybe we're going to use that algorithm to figure out, but do we have a sense for how many we expect to do?
I don't have the number here in front of me, but it certainly can get you that.
Okay, that'd be helpful.
Mr. Chair, I would imagine that the properties that have been vacant for more than 20 years probably have lead pipes, and we can just probably go by age of, you know, if the property has been vacant for that long. I mean, I can bet,
Not necessarily. Not necessarily. Interestingly, and Paul, you're more of an expert on this than I am. We were not using lead connections. Then we started to use lead connections, and then we stopped using lead connections. So there's a period, we believe. And of course, there may be exceptions here and there, but most of it will have happened in a period. And so that's what I believe is a risk. And
Yes, thank you. So the plumbing code, I think it was 1972, outlawed lead. So after 1972, we're fine. It's before that time period.
Yeah. So I guess my question is for that algorithmic consideration, and maybe even more, for the ones that we may have to pay for, the $600 to $700 contract per unit. I want to know like what that overall bucket might look like and what that total expense might look like. I know we're dedicating $22 million towards the inventory and outreach and otherwise, and then we're expecting that 23 million of what we have so far will go toward the replacement. But I'm trying to understand like what the cost will be for the ones that we know we're not going to be able to knock a door and talk to a resident that can then check.
So again, it's an iterative process for this model.
Sure.
I should clarify. So the contract for that $600 or $700 per inspection, that was a $7.6 million contract. Half of those inspections are meant for the county. So the county is going to follow the same approach as us. So we're limited to roughly $3.8 million in this one contract. And I mentioned it at the Board of Estimates. This was really not a pilot, but we started small. We didn't want to have a $20 or $40 million contract out. So we're starting small, making sure we have a process in place to notify the customer before we do the inspection, and then do the inspection, and then what's that process afterwards, whether it's lead pipe or not lead pipe. And then once we have that process, then we can better understand what kind of a contract we're looking at, the size of the contract, the amount of the contract. Maybe we bring that in-house. So we're considering, depending on how this goes, maybe we purchase the equipment and we have our own in-house staff do that. And we have one field crew now. We're putting a second field crew out to do dedicated to the lead program. So that certainly may be possible, which obviously reduces our costs significantly.
Yeah.
So to your point about what that contract's going to look like, again, we don't know how many we're going to need to do for this algorithm. But secondly is we don't know yet if we're going to continue with a private vendor or bring it in-house. Obviously, our choice is to bring it in-house.
Yeah.
We just need to make sure that we have the resources to do it.
Yeah, and I guess a large part of that question is for the, whatever number of vacants we know we have via VBNs, and then the whatever number of vacants that are not VBNs but have been vacant for years, that'll probably help us answer that question.
I would like just to make mention that, so that's one of the new technologies. We are piloting other new non-commercial technologies with EPA. We're actually going to be starting a pilot hopefully next month. So we constantly are looking for new technologies that might help either in reducing the cost if it was a third party or bring it in-house. So some of the handheld scanner that the health department mentioned, we're going to be piloting with EPA on using that same technology for lead pipe. The ones that the health department uses are not meant for pipe, but with EPA's partnership, we're going to try and do a pilot with that. And that might be a wonderful opportunity for us to use some new technologies. It does mean getting to the house. We'll have to figure some of that logistics out. But my point being, leveraging whatever technologies are out there, commercial or non-commercial, to see how we can move forward.
Yeah, and, okay. A couple of things. I had an opportunity maybe a month ago to go to a community association meeting, and there was a DPW community outreach person there. He did a really good job explaining what was going on. I think people still had a really difficult time wrapping their head around what was expected of them. In this community association meeting, it was a bunch of older folks. And essentially you're like, yeah, I'm not going down there to, I mean, you know, you can expect how that went. He was like, you know, a lot of folks are just like, yeah, that sounds too complicated. I'm not going to do that. And we need that participation. So there are going to be varying degrees of ability to do this. And I'm curious if we've had any feedback from folks thus far that might have helped us as we think about outreach, as we think about our explanation of what we are asking people to do, and some of those technological barriers. For instance, we're asking, you know, in this community association meeting, I'll be very generous with ages, but, you know, folks were, you know, into their senior years and just they don't really use computers. And so having them enter this into an inventory could be pretty difficult. Have we thought about some of those challenges and how we might address some of those issues? One, doing the test, and then two, submitting information on the inventory.
Thank you for that. So yes, we have thought about that. That's where the door knocking campaign was going to focus, was those people who, for whatever reason, cannot do a self-survey.
Sure.
What kind of support they can provide. Unfortunately, like I said, we stop at the door. As an alternative is the electroscan, the non-invasive inspection. We can certainly do that. What it comes down to is cost. You know, and as you saw, the 4,400 surveys, while low participation, 2.5% participation, that equates to a $3 million savings.
Yeah.
You know, just a small participation increase will be huge savings for everyone in the city. So that's why we're imploring everyone. If you can do that, if you cannot, then we got to find other ways to either assist those people, whether it's through door knocking or other methods to get that survey done.
Yeah. I'm throwing this out there. It's maybe a terrible idea. If it is, just ignore me. What about like a hotline that folks can call and just note if they're able to check it, but maybe don't feel comfortable using a computer? They can call a hotline and say, hey, look, you know, I tried and this is what came out of it that might help.
Yeah, we have, so through the Department of Public Works, we have a customer escalation unit, and
Great.
one of the things they can do, talk to someone who can help them either complete the survey or answer any questions.
Okay.
Frankly, at least what I've heard anecdotally, not a lot of calls, more questions on how do you get to the website, things like that. But maybe it's on us to maybe provide more outreach on contacting these people if you have questions on how to actually do the survey.
Okay. And last question I have here is regarding renters. So I believe now the program asks renters to leave the checking up to the owner. Does it have to happen that way? My thought is this: not every renter has a good relationship with their landlord,
Right.
and there may be fear of retaliation or
Yes.
fear of a poor interaction that just may inflame a situation that maybe doesn't need that attention. Can you tell me a little bit about what the expectation is for renters, and if there are any sort of flexibilities on how we can think about that?
Yeah, so that messaging was in coordination with our general counsel. I'll
Yeah.
be frank that for the Department of Public Works, we just need to know what pipe material it is, and how that gets to us doesn't really matter to us.
I see. So do what you need to do.
Yeah. I just maybe one thing just in general that we talked about on the participation, I didn't mention in the presentation. So we meet or have talked with several other utility owners, not just here in the state, but in other states throughout the country. And just anecdotally, all of them have experienced the same low participation. They do it, but at the end of the day, other utilities are out excavating and doing potholes to expose the pipe because the participation rate just isn't there for at least the utilities that we've spoken to. And some others, like in DC, they have a large lead replacement program. They've identified a vast majority of their lead pipe, so they're actually more into the replacement part of it than the actual inventory. They still have more inventory to do, but a lot of their work is on the replacement part.
Yeah. I'm out of questions for now, but my ask to you is to use us so that we can beat the mayor's bump. That's all. I want to beat the mayor's bump. You hear that, Councilman? So I think we want to make sure that we are as helpful as possible toward this effort. We want to see as many people submitting their surveys as possible. I know I've been communicating this at every opportunity that I get. It's in my newsletter. It's when I go to meetings, I'm talking about it. Please use the council. Please give us a date, and we'll push it as much as possible, or week, whatever it is. I want to make sure that we're being helpful and that folks are testing these lines so that we can get these lead lines out of here as soon as possible.
Could we maybe record each one of you taking a lead test?
Absolutely. Absolutely.
Thank
We'd
you.
be more than happy to do that.
Thank you very much.
I still haven't done my house. So maybe I'll do that later tonight.
Thank you.
Yeah. All right. Any other questions? All right. Thank you, Paul. I appreciate the work you guys are doing. And once again, any way that we can beat the mayor's number, we're going to do that. All right. This hearing is in recess. This is legislative oversight. We're not doing testimony today. We can talk after. This hearing is in recess.